Hi everybody, welcome back to Ask Away Health and to another health education video. I'm Dr. Sylvia, a general practitioner and health educator. Today we've got a treat for you because we're talking about a condition that many women are familiar with. And I say it's a treat because we're coming to you with lots of information and suggestions, strategies about how to manage these troublesome conditions. And after this discussion with my colleague who's an expert in these matters, you'll be empowered with how to go forward and live your life of the troublesome condition vaginitis. So without much ado, I'm going to be introducing my colleague, Dr. Tolu Adedipe, who is an obstetrician and gynecologist and an expert in vulval health. Dr. Tolu, hi, welcome back. How are you today?
Fine, thank you. And thank you so much for inviting me onto your platform. Lovely to be back and lovely to have another exciting discussion with you.
Great to have you. So we're talking about vaginitis today. I'm going to set the stage and share the slides, and we're just going to go straight into it, going to the first question, which is about vaginitis. So tell us, what is vaginitis? What should we be thinking about when we hear the term vaginitis?
So vaginitis can be a bit of an interesting word because often hear vaginosis, we hear vaginitis, and it's so difficult to actually identify which is which. But basically, vaginitis is pain, inflammation, and a discharge, which could be odorous or not odorous from the vagina. The triad has to be complete. There has to be a discharge, there has to be pain with inflammation or infection.
Okay, so now we've talked about what vaginitis is. Let's go to the next question, which is how common is it? How often do you see cases like this in the clinic?
Oh, it's rather common. It's rather common. And I think even the numbers we get in clinics is actually underrepresented because a lot of women will get interventions or treatments over the counter or at their local pharmacies. And we would say under the age of 50, 55, quite a significant number of women will have some sort of vaginal infection or inflammation during the course of their life. The exact numbers are difficult to identify. However, when we then look at the different causes of vaginitis, we do know that a lot of women, almost half of our population, will have reported some degree of bacterial vaginosis, which is largely an imbalance of the hormones, you see, and therefore leading to discomfort and discharge. Sometimes with inflammation, but not necessarily all the time. A very common vaginitis is candida, so that's thrush, and I'm very sure every woman would have come across thrush or would have talked about thrush with their friends.
That's right.
And lastly, then we then talk about Trichomonas vaginalis or trichomoniasis, which will occur in about a fifth of cases. Not very common, sexually transmitted, but still a concern nonetheless. One of the reasons why we would like to talk about vaginitis is not just because of how common it is, but also the impact it has on a woman, right from the time of infection, leading to potentially infection within the pelvis, commonly called pelvic inflammatory disease. And that could lead on to infertility, and in some cases could also affect the pregnancy. So yes, the woman finds it difficult to fall pregnant, and then on falling pregnant, she unfortunately runs that risk of having a preterm birth, which obviously has negative consequences.
You've talked a little bit about the triad at the beginning. Can you just double down on this or expand a little bit on what exactly is happening when a woman has vaginitis? What are the usual signs and symptoms?
So one of the very common signs of vaginitis is the discharge. A woman notices there's a change to a discharge. Now, we all will have some degree of discharge at any point in time. But when there is now a certain change to the quantity, to the color, to the smell, then there most probably is a concern or there is a problem going on. And particularly where there's an irritation or a burning or soreness, sort of sensation. So definitely a lady needs to have another look down below and possibly attend for tests and investigations to rule out the possibility of an infection.
We've talked about vaginitis, we've talked about the usual signs and symptoms that women can experience, and I think it will be good to, from your point of view as a specialist in vulval and vaginal diseases, what would you be saying to women generally, even before they come to you in the clinic? What would you be saying to women in the community about looking after themselves if they develop these symptoms? And the other thing as well they want to know is if they keep getting the symptoms, what should they be doing?
So fabulous. Once a lady notices that she's got a discharge, she obviously needs to get in touch with a healthcare provider. She needs appropriate testing. I find that a lot of my patients do a lot of trial and error, going onto the counters and picking different lotions and potions. And that's not the right thing to do personally, because oftentimes these infections are not completely treated and they come back again. So please get in touch with your healthcare provider, get the necessary tests done. Now, how do I prevent it from happening again? I think it's just basically, very usual self-help advice, really. You want to keep hygiene to the right levels. And however, as much as you want to keep your hygiene levels up, we normally would advise women to avoid douching, where they alter the balance of the bacteria sat in the vagina, because you've got good bacteria, you've also got bad bacteria. And cleansing, over cleansing sometimes, unfortunately, takes that balance off, as we've seen here, where distortion of the vaginal microbiome, as a result of over cleansing occurs, the pH changes occur. And then, of course, we also notice that in certain times of life, i.e., when a woman is ovulating, when she's pregnant, or under the influence of hormones, she's just more prone to having a bit more vaginal discharge as compared to before. So those basic tips will definitely help in optimizing a vulvovaginal health, so to speak. Examining the vagina is also very important, because we do know that sometimes vaginitis may not necessarily be related completely with infection. It may be related to skin condition or just the general environment. And being able to identify this on time and get treatment on board is certainly the way forward.
So that brings me to another important part of the discussion, which is Vulval Awareness Day, or Vulvovaginitis Day, is coming up on the 18th of September this year, so just a few weeks away. Can you tell us what this day is about? What is your involvement? How can our patients, women generally, participate in the events marking the day?
Fabulous. Yeah, so the Vulvovaginitis Day is to be celebrated on September the 18th, 2023. So that's literally maybe about a month and a half or so away.
Yes.
Basically, it's to raise awareness and also increase advocacy regarding vaginitis. This day has been set apart by the ISSVD, that's International Society of the Study of Vulvovaginal Disease. I happen to be the co-chair of the Vulva Awareness Day, so hence my deep interest in the subject. But what we're trying to do really is we're trying to raise awareness not just amongst our clinicians, but definitely amongst our patients. We know social media goes further than where we could ever reach physically, and I'm hoping that through this day, with your involvement, I can see the contacts down below at the Vulva Awareness Day 2023 at gmail.com and also at Vulvadoc. We're hoping that with your involvement, with you also raising awareness within your local community, we can get the message out to women. We want to make sure there's equitable information dissemination across the way. We want to also raise awareness about vulva examination, preferably to be done monthly. We know that helps with vaginitis reduction. It also helps with reducing other vulva conditions, particularly cancers. Okay. We also want to emphasize on safe sexual practices too, minimizing risk, and also challenging common and, should I say, wrongful information that is available out there. I would love you all to contact me on this Gmail address, because we're hoping to have a series of events, and we're also happy to welcome your thoughts or your ideas on what events you would like to carry out in your own local domicile in order to create this awareness and also engage discussions and advocacy with regards to the subject.
Okay, fantastic. Thank you so much, Dr. Tolu. This was really informative. And for anyone who has concerns about their vulval and or vaginal health, you know where to reach us. You can talk to us on Ask Away Health, or as Dr. Tolu has been saying, particularly marking Vulvovaginitis Day, you can contact her and her team at Vulva Awareness Day 2023 at gmail.com. Follow Dr. Tolu on @VulvaDoc on Instagram to know more about the events and the different educational seminars and collaborations or activities that they're planning towards Vulvovaginitis Day this year. Thank you so much for watching, guys. Please give this video a like and of course consider subscribing to the channel. Dr. Tolu, it's always a pleasure to speak with you. Thank you so much for coming back to talk to us about this important topic, and hopefully we'll see you again soon.
Thank you.